Okay, in this video we're gonna see what comes up when we type baby on ultrasound. And here we can see some pictures. Jewel Women's Center, UT Southwestern Medical Center, Raising Children Network, Women's Care of Alaska, the ultrasound suite, first trimester. We can see pictures from the first, second, and third trimester. This is like an ultrasound. And then we have fetal ultrasound. A baby ultrasound uses sound waves to create images of the fetus in the womb, which helps healthcare providers monitor the pregnancy's progress and your baby's development. These painless scans can check for the baby's size, heartbeat, and position, as well as the development of organs and bones, and the health of the placenta and amniotic fluid. An ultrasound is performed by a sonographer who applies gel to your abdomen and moves a transducer over the skin to get images on a screen. What an ultrasound shows: fetal growth and development. It can determine the baby's size, estimate the due date, and check the development of organs and bones. Fetal heartbeat. A fetal heartbeat can be visualized and measured. Baby's position. It shows how the baby is lying in the womb, which is important for birth. Multiple babies. It can determine if there is more than one baby. Placenta and amniotic fluid. It checks the location of the placenta and amount of amniotic fluid. Potential health conditions. Ultrasounds can help detect certain genetic conditions or birth defects. What to expect during the scan. You will lie on your back and have a clear water-based gel applied to your abdomen. A transducer will be moved over the gel to capture images. The images of the baby will appear on a screen. The scan is painless and a full bladder is sometimes required for a better view. The duration of the scan is typically around 30 minutes. After the scan, you can often ask for copies of the images to take home. Your doctor will discuss the results with you to explain the findings and any next steps. So, what else? We can see what week can we see baby on ultrasound. Let's see. You can often see a gestational sac as early as 5 weeks, but a clear fetal pole and heartbeat are typically visible on ultrasound between 6 to 8 weeks, with a transvaginal scan being more detailed early on, and by 10 to 14 weeks you'll see a more recognizable baby during the standard dating scan, say doctors. Early stages 5 to 8 weeks. A gestational sac, the first sign of pregnancy, might appear according to AT radiology. 6 weeks, a yolk sac and tiny fetal pole. Early baby are often seen, and a faint heartbeat can be detected, especially with transvaginal ultrasound. 7 to 8 weeks, a clear, strong heartbeat and a more distinct embryo are usually visible, making this a common time for a first scan to confirm viability and due date. Notes Baptist Health and North Valley Women's Care. Later first trimester, 10 to 14 weeks. This is when the typical dating scan happens. The NHS states the baby is larger and abdominal scans are more effective, providing clearer images that look more familiar to parents, says Vision X-ray Group. Key takeaway: while you can see glimpses of the baby very early, the 6 to 8 week mark often brings the first clear visual confirmation and heartbeat, with more detailed views in the standard 10 to 14 week scan. Important notice. Okay, abdominal, transvaginal, 8 weeks and beyond. Ultrasound in pregnancy. Okay. When do you have your first prenatal ultrasound? Closer to 12 weeks. 20-week ultrasound. How soon can you see a baby on an ultrasound? Test details. What should I expect? Okay. So, when does a pregnancy ultrasound determine sex? Your baby's sex isn't visible on an ultrasound until about 18 to 20 weeks. Okay. NHS 12 week scan. Okay. And that will be baby on ultrasound.